Welcome to the pharmacology course. My name is Rafiz Kamaliv and we are starting the uh, lecture on pharmacokinetics. So the pharmacokinetics is what the body will do to the drug, and there are four uh, steps of the pharmacokinetics, and the the steps of the pharmacokinetics are absorption, uh, distribution, metabolism, and elimination. So when drug is administered by most of the ways, first it goes through absorption, but when it administered by intravenous, this step is omitted and it directly goes to distribution because the intravenous route goes directly to the plasma. And then the distribution is the second step, and the distribution is the passage of the drug from the blood to the intestinal and intracellular fluids. The after the distribution, the drug will go to the metabolism, and this is the third step. And during metabolism, the drugs are biotransformed by the liver, mostly by the liver, but also by other tissues like the muscles, uh, uh, the fat tissue, and others. And then after the metabolism, the last and the fourth last step is elimination. And elimination is usually by urine, also by kidneys through urine, and by the liver to bile or feces. Uh, so the pharmacokinetics is useful for physicians because they can optimize the treatment and select the most appropriate route of administration, correct the dose, correct the frequency of administration of the drug, and also correct the duration of the treatment. And there are several ways of administration or routes of administration. The most common route of administration is oral by tablet. So the oral route is most flexible, most inexpensive, and the selection of the route of administration depends on the therapeutic goals. So and sometimes especially in emergency cases, the rapid onset of the action is very important, and other cases the duration of the treatment is important, so the long-acting drugs are preferred. And third uh, uh, the third uh, diseases will require the administration only on the local uh, place, on the local site, because they uh, because the drugs can be uh, toxic, and to prevent the systemic toxicity, the drugs can be administered locally, and local administration is maybe the topical. So actually, topical administration or local is by maybe by ointment or by the solutions like drops, ocular drops, for example, uh, and that topical administration usually only influences on the site of administration, so will not have systemic effect to the whole body. Uh, the the most common of route of administration is oral, and oral administration is very useful because patients can administer them themselves, especially if they are not children, and it is the most convenient and cheap way of the administration. And there are two possibilities for the oral administration: uh, the the oral and the uh, sublingual, or the modification of the sublingual is transbuccal. So sublingual is when the tablet is placed under the tongue, and the transbuccal is uh, when the tablet is or the drug is placed between the gums and cheek. So like candy, candy, for example. And uh, oral administration is also very safe way, and overdose can be so in case of the overdose, the drug can be removed from the stomach by or absorbed by the antidote. And the only disadvantage of the oral administration is the low pH of the stomach that can destroy drugs, and also the food that can be present in the stomach, and if the drugs are uh, if the drugs react with the food and or absorbed by the food, then the the dose of the drug can be decreased. The good news is that pH low pH can be overcome by the uh, coating. The tablets can be coated by the uh, resistant uh, to acid cover, and also the special capsules can be used to save the drug from the low pH. And the also some drugs that are irritating the gastric mucosa can be protected by the coating, or can be the powder can be hidden in the capsule that is dissolves only in the intestine. So uh, the capsule uh, usually has a gelatose uh, core that and can be opened and closed. And in recent years, there are plenty of the tablets that have extended release formulations, and these formulations are usually have the same name plus XR or ER, that are extended release, the abbreviation ER. And these drugs are usually slower absorbed and have a longer duration of action. So the next route is parenteral. So parenteral route of administration is divided to three types: intravenous, intramuscular, and subcutaneous. So these are abbreviations of the parenteral routes of administration. And the advantages of these routes of administration is the bypassing of the GI, because most of the drugs, especially the high molecular drugs, are unstable in GI. For example, the proteins like insulin uh, are destroyed in the acid, and that is why they are used only parenterally. And usually drugs are used parenterally in hospitals with severe or ill patients that cannot take oral medicines, or sometimes when the drug has low bioavailability with oral administration, and that is why the drug is administered parenterally. The parenteral administration is better because the dose can be adjusted fast in case of the infusion, and um, and disadvantages of the parenteral administration is the pain in the site of injection, like the needle will damage the skin, and also many patients fear the injections, and that also potentially can lead to the tissue damage and also to the infections. So the intravenous is the most common parenteral route, and it is useful for drugs that are not absorbed orally, and the intravenous route is the fastest route, and the onset of action is fastest for any other route, faster than any other. And there are two uh, uh, two ways of injection as a bolus. Bolus means that all the dose is injected and in one time simultaneously, and this is usually done with a syringe. And the second is with a system, so this is like a packet with a tube, and the tube is connected to the needle, and the needle is actually injected into the skin and connected to the actually injected into the vein. So the systemic infusion can slowly infuse the drug to the blood, and that is usually increases the duration of action of the drugs and can also decrease the maximum concentration in the blood, while still uh, 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 while still maintaining the therapeutic dose that is uh, enough for the treatment. So the uh, subcutaneous and intramuscular injections are uh, also very common and provide the same benefits that the intravenous injection will, will provide. And intramuscular injections should be uh, aqueous solutions, because the oily solutions will be very painful. So any other solutions will be very painful on muscle, and intramuscular injection will give a slow absorption. And subcutaneous injection provides a even slower route than the intravenous route and intramuscular route, and it has a benefit over the previous, that uh, it has less risk of thrombosis, because for example intravenous route has a high risk of thrombosis of the veins because it's injected directly to the veins, and subcutaneous route is more safe, slower, and usually has longer duration of action. However, some drugs that can cause irritation of the tissue cannot be injected subcutaneously uh, because the injection will be painful and then can lead to necrosis. So the insulin actually for the diabetes is administered subcutaneously to provide the long duration of action. So like and also if we compare the plasma concentration after the intravenous injection, the plasma concentration will increase very fast and then decrease fast. So this is not very good because this maximal concentration is higher than the recommended therapeutic concentration. So that is why the intramuscular injection is more safe and is recommended when the rapid onset of action is not uh, required. So other routes of administration include inhalation. So inhalations are used mostly by asthmatic patients with the aerosolum. So the same aerosolum that you use for the uh, deodorant or for like the in perfumery. So these inhalators have an aerosolum and special uh, tube that is inserted to the mouth, and then the button is pressed and the uh, breath in is taken and the aerosol will go to the lungs. So and the absorption will be in the lungs. So first to the bronchiole and then to the lungs. So the second is also aerosol for the nasal inhalation. These are inserted into the nose, and this is very common way of administration for the nasal decongestants like oxymetazoline, so that are used for the treatment of the running nose. So it's very actually very common during the winter season. Running nose is most common symptom of most of diseases during the winter. So in intrathecal and intraventricular they injected directly uh, under the brain. So these are usually very rare cases. The so this way the drugs are injected to the cerebrospinal fluid. So and usually this is very uncommon way of administration. Then the transdermal patch is the transdermal way of administration, and the absorption is to the skin, and the is usually used for the sustained delivery drugs such as nitroglycerin and also nicotine. So nicotine patches are used for smoking cessation. And then the rectal way is the most uh, unpleasant one for the patient, but there is uh, some peculiar, there is a peculiarity that about half of the systemic uh, blood from the rectal region goes bypasses the portal circulation, and that will save drug from biotransformation in the liver. And then also the rectal administration will bypass the GI, and that is why it's useful for anti-vomiting drugs, especially if patient is vomiting during the uh, um, administration of the drug. But the disadvantages is that most of the drugs will irritate rectal mucosa, and that will lead to cramps, so the patient don't like this route of administration. So the next stage is absorption, and absorption can be done with a passive diffusion. Well, passive diffusion is usually for water soluble drugs, and the passive diffusion will take place across the concentration gradient, and that means that the drugs will move from the environment with the high concentration to the place with the low concentration. And there is no any carrier, so there is no anything, so it just goes to the by the concentration. So, and this is the most common way of absorption. And for the uh, hydrophilic drugs, the drugs will penetrate the cell membrane through the channels or pores like this one. And for the lipophilic drugs, they will pass through the membrane on that uh, is without a pore, so they don't need a channel to pass. So the second is facilitated diffusion. Facilitated diffusion uh, has a carrier proteins, and they facilitate the passage for some large molecules, so they carry the molecule from one side, then release it to the another side of the membrane. So the last one is active transport. So active transport will involve the specific carrier, and it will require the energy of ATP. So the same as facilitating diffusion, but additionally ATP is used to make this transfer. Also there is a endocytosis, so but it's not very common, and only for solutions. So the very important feature of the drug is bioavailability, and bioavailability is the rate and uh, rate at which the drug reaches the systemic circulation. So like if we sorry if we administer the drug orally and then measure the concentration under the curve, so if we administer orally, then the concentration will increase and then slowly decrease. But when we administer intravenously, it will be high from the beginning and then will slowly decrease, or decrease actually fast here. So if we calculate this, if we calculate this uh, square, uh, then and divide the oral to the intravenous, and then multiply by 100 because it is in percents, is in percentages, then we will get a bioavailability. Like 100% bioavailability means that it is intravenous infusion, sorry, intravenous injection. But oral bioavailability usually is less than 100%. At its good bioavailability is 90%, and the bad is about 40%, and normal is somewhere in between. Uh, so the hepatic metabolism uh, is usually done for the drugs that are administered that are absorbed in the GI, because everything that is absorbed in GI enters the portal circulation before entering the systemic circulation. And the because of the metabolism in the liver, so when the person will take the drug, it will go to the stomach, and then onto the intestine, it will absorb and then goes to the portal circulation. In the liver, the drugs are metabolized, and sometimes they are metabolized very fast and they are inactivated. And that is why this is called first pass metabolism. And sometimes they are inactivated more than half or even almost everything. And then after the liver, they go to the normal circulation, pass through the heart, and they again return to the liver, and this is the second pass, etc., etc. So and then this way the dose is the concentration is decreased further. So and the after the absorption, there is a distribution phase. The distribution is the process of leaving the blood and entering the interstitium, that is extracellular fluid, and also for some drugs also the intracellular fluids. And the depending on the permeability for the vessels, and blood flow, the distribution phase can take longer, and also binding to the plasma proteins will decrease the distribution, because the drugs that are in the blood will bind. If they bind to the proteins, they will not participate in the distribution. And the there are two types of the distribution, and to depending on the decrease in the concentration, the elimination. So the next phase, elimination can be zero kinetic or can be first kinetic. So these are the modules of the elimination. So the in case of the uh, zero kinetic, the rate of decrease in plasma concentration is constant, and uh, first uh, first kinetic, the rate of decrease is will change throughout the time. And the time that is required to eliminate the half of the uh, half of the plasma half of the steady state plasma concentration is called uh, half elimination time. So, and it is considered that, so it is a constant for every drug, and after 2 times of the half elimination, the 75% of the drug is eliminated, and then after 3 multiplied by this constant, the 90% is eliminated, and we will consider that after 4 multiplied by time of half elimination, all the drug is eliminated completely. So, and also uh, when we change the doses, so when we give drug with the with the therapeutic dose, then it will gradually increase the dose, and the purple is the oral dose, and the blue is the intravenous infusion. And the oral dose will lead to the fluctuations of the doses. So, and that is why the dose will be somewhere between two meanings, two concentrations. So if we change the dose, and sometimes because of these fluctuations, the dose there may be overdose. Like here, the dose will be very high, much higher than the desired is blue. So that is why the intravenous infusion is better, because there is no change in the doses. So thank you for attending. That is all for today, and see you next week.